You imagine yourself in a sterile operating room in 1893, watching a black surgeon named Daniel Hale Williams do something that every medical expert in the world said was absolutely impossible. He's about to cut open a man's chest, reach inside, and repair his beating heart with his bare hands, and if he fails, his patient dies on the table in front of dozens of witnesses, but if he succeeds, he'll change medicine forever. And here's what they never taught you in school: the man who performed. The world's first successful open-heart surgery wasn't just brilliant. He was black, and his story was deliberately buried for over a century because America couldn't handle the truth that a black doctor achieved what white physicians said defied the laws of God and nature. Daniel Hale Williams was born in 1856 in Hollidaysburg, Pennsylvania, just 9 years before the Civil War ended, and his father died when he was only 11 years old, forcing his mother to split up the family because she couldn't afford to keep them together. So young Daniel was sent to live with family friends in Baltimore, where he learned barbering as a trade. And you need to understand something crucial here. In the 1860s and 1870s, barbering wasn't just cutting hair, it was one of the few respectable professions available to black men, and barbers often performed minor surgeries, pulled teeth, and provided basic medical care to communities that had no access to white doctors who refused to treat black patients. Williams worked as a barber for years, but something inside him burned with a hunger for more, a relentless drive to transcend the limitations that white America had placed on black ambition. So in 1880, at the age of 24, he walked into the office of Dr. Henry Palmer, the Wisconsin Surgeon General, and asked to become his apprentice. And this was audacious beyond measure because medical education for black people in America was virtually non-existent. Most medical schools outright refused to admit black students, and the few that did subjected them to such vicious racism that many couldn't complete their studies. But Palmer saw something in Williams, a fierce intelligence and determination that couldn't be ignored, so he took him on as an apprentice, and Williams spent 3 years learning everything Palmer could teach him: anatomy, surgery, disease pathology, diagnostic techniques. And then in 1883, Williams did what seemed impossible. He was accepted to Chicago Medical College, now known as Northwestern University's medical school, and he was one of the only black students in the entire institution. Surrounded by white classmates who believed black people were intellectually inferior and had no business practicing medicine, Williams graduated in 1883, becoming Dr. Daniel Hale Williams, and he opened a small practice on Chicago's South Side, serving the black community that white doctors ignored. But he quickly discovered a horrifying reality: black patients couldn't get admitted to most of Chicago's hospitals, black doctors couldn't get appointments to hospital staffs, black nurses couldn't find training programs that would accept them, and black medical students couldn't get the clinical experience they needed. Because hospitals simply wouldn't allow black professionals through their doors. And this wasn't just discrimination, this was a systematic effort to prevent black people from participating in modern medicine at any level. So Williams did something revolutionary. He decided to build his own hospital, and in 1891 he founded Provident Hospital and Training School in Chicago, the first interracial hospital in the United States where patients of all races would be treated and where black doctors and nurses could train and practice medicine with dignity. And this wasn't just a hospital. This was a declaration of war against medical segregation, a statement that black medical professionals were just as capable as their white counterparts and deserved the same opportunities to save lives and advance medical knowledge. Provident Hospital opened in a converted 3-story building with just 12 beds, but it was fully integrated, both in terms of patients and staff, and Williams assembled a team of both black and white physicians who believed in his vision of medical care based on merit rather than race, and the hospital quickly gained a reputation for excellent care and innovative procedures. But nobody, not even Williams himself, could have predicted what was about to happen on the evening of July 9, 1893. A young black man named James Cornish stumbled into Provident Hospital with a knife wound in his chest. He'd been stabbed in a bar fight, and the wound was just over an inch long, right near his heart, and at first it didn't seem life-threatening, but over the next day, Cornish's condition deteriorated rapidly. He developed severe chest pain, his breathing became labored, and he was clearly dying, and Williams realized that the knife had penetrated deeper than anyone initially thought. It had cut into the pericardium, the protective sac surrounding the heart, and Cornish was bleeding internally, slowly drowning in his own blood. Now you need to understand what this meant in 1893. The heart was considered untouchable. Medical doctrine held that any surgery involving the heart was automatic death. Doctors had a saying: a surgeon who would attempt to suture a wound of the heart should lose the respect of his colleagues. And this wasn't just superstition. This was based on real experience because everyone who had tried to operate on the heart had killed their patient. There were no antibiotics to prevent infection, no blood transfusions to replace lost blood, no understanding of how to keep a patient alive while their chest was open, no x-rays to see what you were doing, and the heart itself was beating the entire time, making it nearly impossible to work on. Williams stood over Cornish's bed and faced an impossible choice: do nothing and watch his patient die slowly over the next few hours, or attempt a surgery that every medical authority in the world said was impossible, knowing that if he failed, he would be blamed for killing his patient, and as a black doctor in 1893, he had to be twice as good to be considered half as qualified. Any failure would be used as evidence that black physicians were incompetent, that they couldn't handle the responsibilities of modern medicine, that the entire experiment of black medical education was a mistake. But Williams wasn't thinking about reputation or race or medical politics. He was thinking about James Cornish, a 24-year-old man who deserved a chance to live. So on July 10, 1893, Williams assembled his team. He had no specialized cardiac instruments because they didn't exist. He had no cardiac surgery textbooks because they hadn't been written. He had no mentors to guide him because nobody had ever successfully done what he was about to attempt. All he had was his knowledge of anatomy, his surgical skill, his steady hands, and his absolute refusal to let James Cornish die without a fight. Williams cut open Cornish's chest between the 5th and 6th ribs, and you have to picture this. The operating room is lit by gas lamps because electric lighting is still rare. There's no anesthesiologist because that specialty barely exists. Instead, there's a nurse holding a cloth soaked in chloroform over Cornish's face to keep him unconscious. There's no monitoring equipment to tell Williams if his patient's heart is still beating strong or failing. There are no gloves because germ theory is still controversial and many doctors don't believe in it yet, and Williams is working entirely by feel and sight, cutting through muscle and tissue, pulling back Cornish's ribs to expose his chest cavity. And then Williams sees it. The pericardium, the sac around the heart, is torn and filled with blood, and through that tear he can see Cornish's heart, beating rapidly, desperately trying to pump blood through a body that's running out of time, and the heart itself has been nicked by the knife. Not a deep cut but enough to cause bleeding, and Williams knows that one wrong move, one slip of his hand, one miscalculation, and he'll tear the heart muscle and Cornish will bleed to death in seconds. Williams carefully opens the pericardium wider so he can see what he's working with. He clears out the accumulated blood, and then, using a standard needle and thread because specialized cardiac sutures don't exist yet, he begins to repair the pericardium, his hands steady despite the enormous pressure, despite knowing that medical history is watching, despite knowing that he's doing something that's never been successfully done before, and he places each stitch with perfect precision, closing the tear in the pericardial sac, and then he does something even more audacious. He stitches the small nick in the heart muscle itself. He literally sews together living heart tissue while it's still beating, still pumping, still keeping James Cornish alive. The entire operation takes about 2 hours, and when Williams finally closes Cornish's chest and steps back, nobody knows if the patient will survive. Infections kill most surgical patients in this era, and Cornish's body has been through massive trauma. But Williams has done everything humanly possible. He's pushed the boundaries of medical science further than anyone thought possible, and now all they can do is wait. And here's where the story becomes miraculous. James Cornish survives, not just for a few days or weeks, but completely. He walks out of Provident Hospital 51 days after the surgery, fully recovered, and he goes on to live for 20 more years, dying in 1913 of causes completely unrelated to his heart. And Daniel Hale Williams has just performed the world's first successful open heart surgery. He's proven that the heart can be operated on, that cardiac surgery is possible, and he's opened a door that will eventually save millions of lives. But here's what makes this story even more remarkable and infinitely more tragic. The medical establishment largely ignored Williams' achievement. The surgery wasn't widely reported in medical journals at the time. White physicians who later attempted similar procedures often got the credit, and Williams himself was so concerned about being accused of self-promotion or being seen as an uppity black doctor challenging white medical authority that he didn't aggressively publicize his success. He simply published a brief report in a medical journal and continued his work at Providence Hospital. Williams went on to have an extraordinary career. In 1894 he was appointed chief surgeon at Freedman's Hospital in Washington, D.C., which was the main hospital serving the black community in the nation's capital, and he completely reorganized it, transforming it from a poorly run institution into a modern hospital with high standards. He established a training program for black nurses. He insisted on thorough patient records, he implemented antiseptic surgical techniques, and he performed hundreds of successful surgeries, and in 1913, he became the only black charter member of the American College of Surgeons, a professional organization that set standards for surgical practice. But Williams' personal life was complicated and painful. He married Alice Johnson in 1898, but the marriage was troubled, partly because Williams was so dedicated to his work that he neglected his personal relationships, and partly because of the immense pressure he faced as a prominent black professional in an era of intensifying racial violence and discrimination. They divorced in 1924. And Williams, who had given so much to medicine and to breaking down racial barriers in healthcare, spent his final years in relative isolation, suffering from depression and feeling that his contributions had been overlooked and undervalued by the same medical establishment he had worked so hard to integrate. Daniel Hale Williams died in 1931 at the age of 75, and even in his obituaries, many newspapers downplayed or completely omitted his groundbreaking cardiac surgery, focusing instead on his role in founding Providence Hospital, which was significant but not nearly as revolutionary as what he had accomplished in that operating room in 1893, and the systematic erasure of Williams' achievement is part of a broader pattern of how America has consistently minimized, ignored, or outright stolen credit from black innovators, inventors, and pioneers who made contributions that fundamentally changed American life and human knowledge. You need to understand what Williams was up against. He performed this surgery during an era when lynching was at its peak in America, when the Supreme Court had just legalized segregation with Plessy versus Ferguson, when black people were being systematically stripped of voting rights across the South, when the Ku Klux Klan was resurging, and when pseudoscientific racism was being taught in universities as legitimate science, with white professors claiming that black people had smaller brains and were biologically inferior. So every single achievement by a black professional was a direct challenge to the entire structure of white supremacy, and the white establishment responded by simply pretending those achievements didn't exist or didn't matter. And it wasn't just Williams. The pattern repeats over and over throughout American history. Garrett Morgan invented the traffic signal and the gas mask but rarely gets credit in textbooks. Lewis Latimer made crucial improvements to the light bulb and worked directly with Thomas Edison but is virtually unknown. Granville Woods invented the railway telegraph and dozens of other electrical devices but died in poverty while white inventors built fortunes on similar innovations, and in medicine. Specifically, Dr. Charles Drew revolutionized blood plasma storage and basically created the blood bank system that saved countless lives during World War II. But he was later refused treatment at a white hospital in North Carolina and died from injuries that could have been treated. The same medical system he had helped build wouldn't save him because of the color of his skin. Williams' story forces us to confront an uncomfortable truth. American medical history as it's typically taught is a whitewashed version that systematically excludes black contributions. When we learn about medical pioneers, we hear about William Halsted and the Mayo brothers and Jonas Salk, all brilliant physicians who deserve recognition, but we don't hear about Williams. We don't hear about Dr. Rebecca Lee Crumpler, who became the first black woman to earn a medical degree in America in 1864, and spent her career providing care to freed slaves who had no access to medical treatment. We don't hear about Dr. Vivian Thomas, who despite not having a medical degree developed the technique for the first successful open-heart surgery on a blue baby in 1944 but wasn't allowed to operate himself because he was black. So a white surgeon performed the procedure while Thomas stood behind him providing instructions. The erasure of Williams from mainstream historical memory isn't an accident, it's not an oversight, It's a deliberate choice by generations of historians, educators, and medical institutions who found it more comfortable to tell a story of American medical progress that centered white achievement and marginalized or completely excluded Black excellence. Because acknowledging Williams' genius, his courage, his groundbreaking surgery means acknowledging that Black physicians in the 1890s were performing medical miracles while being systematically excluded from white hospitals. It means acknowledging that the segregation of American medicine wasn't just unjust, it was scientifically counterproductive. It held back medical progress by excluding talented Black doctors from the mainstream of medical research and practice. And here's what's even more infuriating. While Williams' achievement was being buried, white physicians were building careers and reputations by attempting similar cardiac procedures, often with far less success, and getting celebrated as pioneers. The medical textbooks written in the early 20th century that discuss the development of cardiac surgery frequently mention white doctors who attempted heart operations years after Williams, giving them credit for courage and innovation, while Williams, who actually succeeded first, is relegated to a footnote if he's mentioned at all. Providence Hospital, the institution Williams founded, continued to serve Chicago's Black community for decades, and it trained generations of Black physicians and nurses who otherwise would have had no opportunity to enter the medical profession, and the hospital's model of interracial staffing and patient care was radical for its time and proved that integration could work, that excellence in medicine had nothing to do with race and everything to do with skill, dedication, and access to training and resources. But even as Providence Hospital thrived, the broader American healthcare system remained rigidly segregated until well into the 1960s, with Black patients forced into separate and inferior facilities and Black medical professionals systematically denied the opportunities available to their white colleagues. Today, there's a Daniel Hale Williams statue at the International College of Surgeons in Chicago. There are schools and medical facilities named in his honor, and medical historians have worked to restore his rightful place in the history of cardiac surgery. But the average American still doesn't know his name. If you ask people who performed the first open heart surgery, most will guess a white doctor from the mid-20th century, or they'll simply say they don't know, because Williams' achievement isn't taught in most American schools, it's not part of the standard narrative of American medical history, and that absence isn't neutral, that silence sends a message about whose achievements matter and whose can be forgotten. The story of Daniel Hale Williams matters for so many reasons. It matters because he saved James Cornish's life when every other doctor would have given up. It matters because he proved that cardiac surgery was possible and opened a field that has since saved millions of lives. It matters because he built institutions like Providence Hospital that provided care and training opportunities where none existed before. It matters because he succeeded despite facing obstacles of racism and segregation that would have broken most people. But most importantly, it matters because his story reveals the pattern of erasure that has hidden so much Black achievement from American consciousness, the pattern that makes it seem like Black Americans were passive recipients of white benevolence rather than active agents of change and progress who succeeded despite systematic oppression. When you learn about Daniel Hale Williams, you're not just learning about one man or one surgery, you're learning about the thousands of Black doctors, nurses, scientists, and medical professionals who contributed to American medicine while being forced to work in separate and unequal facilities, who saved lives while being denied basic respect, who advanced medical knowledge while being excluded from medical societies and professional organizations, who performed miracles with inadequate equipment and resources while their white colleagues in well-funded institutions got all the recognition and reward. And you're learning about how American institutions have consistently chosen to forget these contributions rather than acknowledge the genius and resilience of Black professionals who refuse to be limited by white supremacy's boundaries. So here's what you need to remember. On July 10, 1893, in a small 12-bed hospital on Chicago's South Side, a Black surgeon named Daniel Hale Williams cut open a man's chest, reached inside, and repaired his beating heart with his bare hands. He did what everyone said was impossible. He saved a life that everyone else had given up on, and he proved that the boundaries of medical science could be pushed further than anyone imagined. And then America spent the next century trying to forget his name, trying to erase his achievement, trying to write him out of the history books. But the truth remains, Daniel Hale Williams performed the world's first successful open-heart surgery, and every cardiac surgeon who has followed in his footsteps, every patient whose life has been saved by open-heart surgery, every medical student who learns cardiac techniques, they all owe a debt to a black doctor who refused to accept that anything was impossible, who saw a dying patient and chose to fight for his life even when the odds were astronomical, who opened doors that had been locked shut and proved that excellence knows no color, and his story deserves to be told, remembered, shared, and celebrated, not as a footnote but as a central chapter in the history of American medicine and the history of black achievement in America, because Daniel Hale Williams didn't just save one life in 1893, he changed medicine forever, and it's time we finally gave him the recognition he earned.